Welcome to Adapter NCLEX, and thank you for deciding to watch this video. I wanted to review something about childhood fever, three fever disease that we've seen multiple times, Kawasaki disease, scarlet fever, and rheumatic fever. Typical board questions, they can bring it to see if you understand the underlying problem and the pathophysiology. And so I'm using that as a case study. I'm going to show you, this is usually use this to learn how to go through the cases, and you see that it's straightforward. So, okay, so what is the question? The way to go about doing these cases is you don't have to read it too fast. There's time, you have enough time. Read the first time and underline the keywords. I call them the buzzwords to get the content, and then figure out what is the actual problem. And when you figure it out, that's all. You don't need to go keep on reading the question. You already have the main idea. What is the content? And every subsequent question, you can use it to answer it. So what is the problem? The scenario is always very important. A 4-year-old, then you have to think, it's not a 7-8-year-old, it's a 4-year-old. So I'm dealing with the kid in the emergency room. A 4-year-old, you underline, was brought into the emergency room by the mother. In your test, since you cannot underline, you can take the whiteboard and write 4-year-old. Mother report what? Fever 102 for 6 days. Then you say, oh, 6 days of fever. There's a yellowish discharge from both eyes that did not respond with antibiotics. So something in the eyes that did not respond. And a rash that started from the neck. The neck, you see the description, and now it has spread to both feet. It's gone down. She noticed that the hands and feet are all swollen. So hands and feet are swollen. The client had to be forced to drink anything. Does not want to eat due to what? Pain with swallowing, having problems swallowing, dysphagia, and a swollen tongue. The tongue is big. 2 days ago, the mother felt a large masses along the jaw. This is the way she described it. Along the jaw, what do you get over there? Lymph nodes. So when they came in emergency room, temperature 102, heart rate 110, blood pressure 100/70, respiratory of 18, and saturation 95% on room air. Physical exams, I just summarized. The kid is lethargic. You have chapped lips and strawberry tongue, maculopurple rash that's from the neck all the way to the lower legs. And then both hands and feet are swollen. There's a big lymph node greater than 1.5 centimeter along the cervical region. That's the mother was describing along the jaw. There's mucositis. Guys, after you read this, you should not be in vacuum. Something at least with your content, if you're studying enough, you can figure it out. Luckily, if you make the diagnosis, they will tell you, and you can use it to answer the next question. But I don't want you to make the diagnosis. I want you to ace the test so that the computer stops at 85. Okay? Because you know it. So you should be able to make the diagnosis, right? We have what? What is the issue that we have? We have a 4-year-old, right? Who has more than 5 days of what? Fever, right? We have lymphadenopathy, right? We have a strawberry tongue, right? What else do we have? We have a rash, right? All these things, and we have a mucositis. What do you think this is it? This is what I call if you watch my videos, I call it the T cream. T cream. T is the temperature, 102. Cream is the conjunctivitis over there, the mommy described on both eyes, right? E is the edema, still as an edema there, right? So we have edema. So the E or erythema rash. So rash and edema of both hands. And A is adenopathy. Okay. lymphadenopathy. M, we have mucositis. S, we have a strawberry tongue. And the T, like I said, temperature. And C is the conjunctivitis, which I did not put it over there. As the mnemonic described, yellowish discharge from both eyes. What is T cream? If you watch my videos, this is Kawasaki disease. This is Kawasaki. Kawasaki disease. You should have fever for more than 5 days. I've broken down and the physical exam shows you chapped lips, strawberry tongue, maculopapular rash, lymphadenopathy, mucositis, bilateral hand and feet, and the leg. They have to give you all these facts. They will give you to you. Sometimes they want you to know expected finding. Yeah. But if it's in a history, sometimes they will list all of them, not all of them. They'll give you enough to make the diagnosis. This is the way I want you to break down the question. Spend some time and say, okay, this is what I have. I know Kawasaki. I know what is expected of Kawasaki. And then you'll be able to answer the question. Okay, the knowledge for Kawasaki is because of all these swollen tongue, and then they can't drink anything. That's why the kid has to be forced, and therefore he has chapped lips. Because of that, it's tachycardic, it's slightly hypotensive, it's dehydration. And the fever of greater than 5 days is the diagnostic information. That is your content right there. Content. That's all. Now that we broke it down, let's see what the question is asking us. We said, which of the highlighted information need further intervention? So the highlighted information that we saw over here is the same thing. I wrote it back so that we don't have to keep on going back and forth. So temperature of 102, heart rate, saturation, lethargy, strawberry tongue, and cervical lymphadenopathy. This is an expected finding. Strawberry tongue is an unexpected finding. This is select or apply. Pick those that you think you're confident. Otherwise, you lose the point. If you don't want to lose the point, pick those that you want, you think you 100% sure. We know about strawberry tongue, but it's an expected finding. There's no need further intervention. Cervical lymphadenopathy, that's not. Lethargy, of course, because of the dehydration. 95 is okay in rheumatic, the kids. Heart rate of 110, yeah, all dehydration. And the temperature of 102, even though that one is expected, I'm still worried about it. Temperature is going. The evidence of temperature means the coronary artery is in trouble. This is what we worry about them. Every time they have temperature, that means there's ongoing vasculitis. This is a vasculitis problem. It's a big vessel problem. Therefore, when the plan in their management is to try to lower the temperature as much as possible. And then if there's ongoing temperature, you have to worry about it. But these two strawberry tongues, there's no need to intervene. When you start feeding the kid, it will get better. Dehydration, cervical lymphadenopathy is a reactive problem. Kid is saturation. So priority, you have to be sharp. Being sharp means something that will kill the patient. Being lethargic is not good. Heart rate of 110 is good. 102 temperature is not good because your proteins will start to fry out. The protein will die. So those are the three. Like I said, if you are not sure, pick. This, you get 3 points. If you just pick two, yes, you get 2 out of 3. But if you pick more, they will take point and you end up having 0. Okay, so that's how you answer this question. Okay, I'm trying to slow down and break it down to you as much as possible. This test is doable and you're going to pass. Now, we already have the diagnosis, right? But you have to know the difference. This client is experiencing what? Is it scarlet fever? Of course, yes, it can be. What is the scarlet fever? This is where you bring your content. This is where I want to emphasize to give you guys all the 3 fevers that they can give you. If this is a board question, this is the way they're going to set it, because those are the way you can distinguish between scarlet fever, Kawasaki, and rheumatic fever. This also happens when you have strep infection, okay? You also have fever, but the fever, it doesn't last that long. 5 days, more than 5 days, it doesn't happen that way. Okay, they have fever. They also have strawberry tongue. You see? Scarlet fever, strawberry tongue in the tonsil area and another thing. But what is the problem? They have a rash too, but their rash is called sandpaper rash. The doctor has to describe that as a sandpaper rash. They also have a lymphadenopathy on the cervical area. You see how this can be confusing? Cervical lymphadenopathy is the same, but they are, this thing is rash is sandpaper rash. And these people, you do strep test and you know that they have a strep infection. So they usually have a strep infection and then they develop the rash. You start from the head down, but it's like sandpaper and kind of, and the swollen tongue. In the treatment is you just give them penicillin, okay? Penicillin, so that they don't have complication of that. That is very, very important. How about rheumatic fever? The same thing. Rheumatic fever is the same thing. Content. I'm trying to use this as a content review. What is rheumatic fever? The same thing. They too, they have a strep infection. And after 2 to 3 weeks, they starting having rash. Okay. And then they have a heart manifestation. This is heart problem. They can get a heart problem with it. And they start having murmur. The mitral valve is in trouble, is affected. But how do you remember this disease for rheumatic? Is Jones. Jones is your best friend. They have joint problem. So this is joint problem. Okay. They have O is the cardiac problem. So O is cardiac. The I, okay, they know the N, they have nodule on their skin. Okay, and the E, they also have rash. And the S is the chorea. They have a chorea movement, like a snake. And Jones is your friend for rheumatic, but they also have the same thing. This is specific for that. And so I've broken down everything for you. This is how you can know the difference between scarlet, rheumatic fever, and scarlet Kawasaki disease. And therefore, we know that this was a Kawasaki disease based on what? 5 days of fever, not based on strawberry tongue, because then scarlet fever do have it. Not due to maculopapular rash. Both of them can have, all the 3 of them can have rash, but their rash is different. And the scarlet fever rash is sandpaper. Sandpaper. They have to describe it sandpaper. So Kawasaki based on 5 days. Which of the following is consistent with the disease process indicated below? Option can be used more than once. Now, we got to break it down. I've already done it here for you. What is the issue? Fever, scarlet fever, do have it. Okay, after pharyngitis, after sore throat, yes. Cardiac, for this kind of table, when they give you, in order not to get confused, take one item and go down in relation to one disease. You take scarlet fever, forget about rheumatic and Kawasaki, and go down with one side. And when you finish, go to the next one. Cardiac involvement, there's no scarlet. Cardiac involvement in scarlet fever. Strawberry tongue, yes. Chorea, they don't have chorea movement like a snake, no. Sandpaper rash, yes. Rheumatic fever, of course, you have to have fever. You have to have sore throat. It's a cardiac involvement. They have a erythema at the back of your tongue, but we don't call it strawberry. They have chorea movement, but there's no sandpaper. Kawasaki, of course, fever. They have pharyngitis. There's a cardiac involvement. There's a stroke and strawberry tongue. There is no chorea, and the rash is not described as sandpaper. You see what I've done? You have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 12 points, 12 out of 12. Once again, if you don't know the answer, leave it be because they will take a point. Pick those you're confident. You can get 10 out of 12, 5 out of 12, but I don't want you to get 5. I want you to get all the points. So get your content down. And I can help with that. Just check my channel and you will see you'll be more confident about these problems. No worry about anything. And when you're answering them, you see, oh, I've seen this before. I know this kind of thing. Okay. So now we make a diagnosis. The client was diagnosed with Kawasaki disease. Which of the following the nurse should anticipate? Content, Kawasaki. What is the problem? The major problem with this is vasculitis. And these vasculitis affect your coronary artery. And so they will develop aneurysm. We want to prevent this aneurysmal formation so that the kid doesn't have a problem. How can a 4-year-old kid have a coronary aneurysm? It's not a good idea. We want to help with that. And what do? To prevent this problem, we give them aspirin, okay? And then we give them immunoglobulin. These two will prevent the aneurysmal formation. So we help in the prevention of the coronary disease and then lowering the fever. So that is the main reason we give it to them. Of course, somebody will say, a kid who is 4-year-old had a UR symptoms and we're giving them aspirin. What complication do you get from it? You're not supposed to give aspirin to what? A kid that is young kid, especially a 4-year-old, because what? They will have Reye syndrome, whatever you want to call it. And because of that, we prefer acetaminophen. And so you give acetaminophen for this patient instead of acetylsalicylic acid. So, or aspirin. You don't want, even bismuth. Sometimes they will give you this bismuth that's aspirin in it. So we don't give it to them, but this is the problem. Developing a coronary aneurysm is worse. This is worse. This is deadly compared to them developing Reye syndrome. The Reye syndrome, we will monitor them. Mommy will monitor. If they have any early signs, they will come in and we take care of it. But coronary aneurysm, we cannot reverse it. We are in trouble. So we will give them the aspirin and we'll give them the immunoglobulin. So that's the content. So administer aspirin, anticipated. Immunoglobulin, anticipated. Hold nasal flu vaccine for 6 months. The immunoglobulin, okay, the immunoglobulin, it will make them immunocompromised. So immunocompromised, that means they like somebody getting chemotherapy. They are at risk of infection. So you cannot give them a live vaccine. No live vaccine. Don't forget this. This is a content you should know. No live vaccine for anybody who get immunoglobulin. And therefore, since they cannot get a live vaccine, the nasal flu, yeah, they can. They can get a IM one. IM flu vaccine, yeah, they can get it, but not the nasal one. What are the other live vaccine? MMR. Measles, mumps, rubella, they cannot get it. Okay, those are all. Then oral form of polio, OPV, oral form of polio, you cannot get it. That are all live vaccines. So we got to wait 6 months before we give them those. So you got to hold it. CMP. Why is CMP? You got to check their lab so that you can see the albumin. The albumin level will be low. That is why they have edema. So CMP is indicated. So they have low albumin. Hydration. Somebody who has a fever of 102, a chapped lips, and a strawberry tongue, that they cannot take anything. What do you think? We got to help them. So hydrate them. Cardiac ultrasound. We already know. I told you they will develop coronary artery aneurysm. So get an ultrasound to make sure this has not developed already. This is content, people. And this is all you need. You will not find anything like that anywhere, but I give it to you. And this is the way it's supposed to be done. Classic way of Kawasaki disease. And this video will tell you everything. If you watch this video, whatever time it takes, you know everything about Kawasaki, and there should be no question that will kill you from this. Okay? So, next one. The client received immunoglobulin infusion. The nurse knows that the major complication of this drug is what? The reason why I know how to say these questions or what they can ask you is because I know the clinical implication. So you got to go for the source. Okay, clinical implication. Immunoglobulin, what is that? It's an albumin. Okay. What does albumin does? So this is your blood. I give you an albumin. Albumin is going, this is your tissue. It's going to pull all the water inside your vascular system. That's what you do. You hold on to water. So all the edema that you have in your tissue, albumin will pull it back into the blood. So now your blood volume will increase. Where does all the blood volume go? It goes to your lung and your heart. And so the big complication with this is heart failure or pulmonary edema. These two things you have to watch in the patient. So what is the complication? Rey syndrome is for the aspirin. So don't be fooled by that. Coronary aneurysm. I intentionally did that. This is the problem with Kawasaki, not the immunoglobulin. You have to answer the question being asked and expect them trapping you with that. The Kawasaki will cause coronary aneurysm. The immunoglobulin will prevent the coronary aneurysm. The biggest complication of the immunoglobulin, heart failure and the pulmonary edema. So I put it there because you think Kawasaki causes coronary aneurysm. Don't pick it. That's a trap. Heart failure, yes. Hyperalbuminemia, yeah. The albumin will go up. But is this more dangerous than heart failure? No. Your albumin go up, so you have hyperalbuminemia. But your heart failure is more dangerous than this, being a priority intervention. Could be major complication. Risks of infection. Yes, you get a risk of infection. You make you immunocompromised. But is it better than heart failure? Think. So priority, priority, priority. So heart failure is worst. So I'll pick that answer choice. We're almost done. Now, kid did well, is going home. What do you tell the mother? At discharge, which of the following statements need immediate intervention? Select all that apply. Pick those you think you can answer it well. If you don't know it, just leave it so that you don't lose the point. But I want you to pick all the answers. I want you to pick all the answers. So the same content you bring in, we know the patient have Kawasaki. What do you tell the mommy? I will watch for sudden onset of lethargy, vomiting, confusion, and change in mental status. You said, what is that? Kid is lethargic, okay? He's vomiting, GI symptoms. He's confused. He can't think. and he has mental status change. Critical thinking. That's why I said this case is a critical thinking. How? Which things will cause you that? Is the kid is not drunk, right? Vomiting, confusion, change in mental status. There's no trauma anywhere. That means we're giving the kid something that has caused the kid now is becoming lethargic, vomiting, confusing, and then mental status change. We've already hydrated them, we've taken care of them. This is your race syndrome. It's because we're giving them aspirin. So, yes, I will watch for that. Yes, mommy, watch for that. I will monitor client temperature every 6 hours for 2 days. Yes, I told you every time the temperature persists, we having aneurysm formation. So we want to break the temperature as soon as possible. The first 2 days is critical when you discharge them home. So do that. I will call if the temperature does not resolve. Yes, related to that. My kid is at risk of coronary artery aneurysm. Yes, that's why we want to control the temperature. Okay to have oral polio vaccine. This is a live vaccine. Therefore, no, negative. You can't have it. You get sick. So we cannot have it. And this is everything about Kawasaki. Kind of questions they're going to ask you, the pathophysiology, the content, the comparison between other fevers, and the clinical management and implication. I hope you understand. I hope you enjoy. Thank you for watching. Thank you for learning something. And subscribe if you've not subscribed. And keep charging because you're going to be successful. And this test will be history. All the best of luck and adapt the NCLEX. Get your back. Take care of yourself. Bye-bye.